Hello and welcome to News Voice Network. Today we're diving deep into a story that has sparked heated debates worldwide. Imagine this, a push to revoke the approval of the polio vaccine, a vaccine that has played a pivotal role in eradicating polio in many parts of the world. Controversial? Absolutely, but what's driving this decision? And more importantly, what could it mean for global public health? Let's break it all down. First, let's talk about the vaccine itself. The polio vaccine has been a cornerstone of global health efforts for decades. Developed in the 1950s, it has virtually eradicated polio in the United States and significantly reduced cases worldwide. However, a 2022 petition, spearheaded by Siri, a lawyer for the Informed Consent Action Network and a known associate of Robert F. Kennedy Jr., has called for the FDA to revoke its approval. Their argument? A lack of modern, comprehensive, double-blind studies proving its efficacy and safety. But why would anyone question something so universally celebrated? According to Kennedy, this isn't about being anti-vaccine, it's about ensuring transparency, safety, and accountability in vaccine approval processes. He has repeatedly voiced concerns about the relationships between pharmaceutical companies and regulatory agencies. So, what does Kennedy and his team propose? They are asking for a reevaluation of the vaccine using modern testing methods. This means randomized, double-blind studies, considered the gold standard in scientific research, to reconfirm the vaccine's safety and efficacy. They also argue that the vaccine does not fully prevent transmission of the virus, questioning its continued approval. Supporters claim this is a step towards ensuring better regulatory standards. Critics, however, argue that this approach undermines public trust in vaccines. They fear it could lead to a resurgence of polio, a disease that once paralyzed and killed thousands annually. Now let's discuss the potential impact of such a decision. First and foremost, public health. Revoking the vaccine's approval could pave the way for declining vaccination rates, potentially bringing back a disease we thought we had defeated. Remember, polio is highly contagious and can cause irreversible paralysis or even death. Even today, some regions like Afghanistan and Pakistan continue to battle polio. A reduction in vaccination coverage could spark new outbreaks, putting millions of lives at risk. Second, this decision could create a domino effect. If the polio vaccine is revoked, what's next? Measles, mumps, rubella? This could set a precedent that questions the safety of all vaccines, potentially throwing public health systems into chaos. The societal implications are just as significant. Vaccine skepticism has been on the rise, especially after the COVID-19 pandemic. A decision like this could amplify distrust in medical science and public health institutions. On the other hand, proponents argue it could lead to more rigorous standards, ensuring every vaccine meets the highest safety benchmarks. Ultimately, the question boils down to this: should we reevaluate a vaccine that has been so effective for decades, or does that risk outweigh the potential benefits? What do you think? This is where we want to hear from you. Do you support Kennedy's push for a reevaluation of the polio vaccine? Or do you think this could lead to dangerous consequences for public health? Share your thoughts in the comments below. Let's have a respectful and meaningful discussion about this critical issue. Don't forget to like, share, and subscribe to News Voice Network for more in-depth coverage of the stories that matter most. Together, let's stay informed and amplify our voices.